Symptoms of hypothyroidism. Hi, Dr. Davidson here from ProgressYourHealth.com. In this presentation, I'm going to talk about some of the symptoms of hypothyroidism. A lot of our patients that have hypothyroidism constantly complain about their low energy. They feel exhausted all day, tend to sleep longer, and it's incredibly hard to wake up in the morning. With hypothyroidism, you'll also see a lot of patients that are very anxious and overwhelmed because they just don't have the energy needed to get through their day because their hypothyroidism is creating such low energy. So it's important to treat patients with hypothyroidism so that they can feel better, that they're not exhausted, that they can wake up bright-eyed, bushy-tailed, and certainly take away that anxiety. Other symptoms of hypothyroid that we'll see is a low mood, feeling sad for no reason. Patients will complain about they're feeling sad. Life is great, but they don't feel great. Family's great. Things are great, but they just feel really melancholy and their mood is low for no reason. And that's very common in hypothyroidism. You also see a lowered mental alertness, forgetful, hard to concentrate, very difficult to focus, hard to make decisions. Also, you'll see a very slow metabolism, resulting in very easy weight gain. Hard to lose weight, very easy to gain the weight. Also, you'll see high cholesterol with patients with hypothyroidism. You'll also see hair loss, dry skin, constipation and bloating, and you'll even see low fertility associated with hypothyroidism. Hormonal imbalance is very common in hypothyroidism. I'll get patients that come into my office and they'll be sitting there saying that their doctor wants to put them on birth control pills and Lexapro, but that's only because they're having symptoms of hormonal imbalance that's resulted from the hypothyroidism. When thyroid is low, thyroid is upstream from your female reproductive hormones and the male reproductive hormones as well. So you'll see this hormonal imbalance where patients will complain about heavy periods, mid-cycle spotting, painful periods, emotional, feeling irritable very easy, and of course their doctors want to put them on birth control pills and antidepressants, but really you have to check that thyroid because low thyroid hormone tends to affect the female reproductive hormones, causing them to be imbalanced. Also, I'll see women in their 40s going through menopause, and honestly, women in their 40s are not supposed to go through menopause that early. Menopause typically starts at the average age is 51.5 years of age. So women in their 40s complaining of menopause is really a big indication that we need to look at their thyroid. So be sure to watch our next video in this series called Causes of Hypothyroidism to learn more. For more information, visit our website, which is www.progressyourhealth.com.